Hello, today I'll be doing my presentation, Acupuncture within the military for pain control. My PICO question is, in the military population, does acupuncture lead to better or same results of pain management than that of pain management medication utilizing objective pain scales? Acupuncture is 2,000-year-old medicine that's over 2,000-year-old that is from China. It is originally thought that there are channels and branches within the body, and pain blocks these branches, and acupuncture comes in to relieve these blockages to allow for homeostasis within the body. There are two types of acupuncture. There's mechanical acupuncture as well as electrical acupuncture. Both these utilize the dry needling technique, which the needle goes into the body by force. Some twisting may be involved, and the goal is to stimulate the A beta. They might also stimulate some A delta as well as some C fibers. The electrical acupuncture, the difference with this is that it can be used to stimulate the opiate peptides within the body as long as there's a frequency of 2 to 100 hertz to stimulate that electrical frequency, much similar to TENS or STEM in that nature. In a study of 60 volunteers, 54 felt the live needle go into their skin, and as well as in that same 60, after another trial, 47 of those 60 felt a placebo needle. So it is, relative information to understand that there might be some placebo aspect involved with acupuncture. More studies would be needed to follow up on that nature. A little bit more on the military side of things. In Afghanistan and Iraq, there was over 51,000 military members that were wounded in action. In a study of 2,600 that deployed to Iraq and Afghanistan, 44% of them experienced chronic pain, and 55.6% experienced some sort of daily pain with daily activities of daily living. In that 2,600, 50% consume opioids. And as we know, there's the opiate pandemic going on currently, and opiates are a very hard drug that is used to control pain, but it also has a very high addictive rate, and which can be very detrimental to the human body. In that, 80% of the opioids were prescribed by primary care physicians, while less than 1% of the prescriptions were done by a pain specialist. That's a little alarming, seen as how addictive and hurtful opiates can be towards the body, that they weren't given by a pain specialist that might be able to better analyze if opiates are the necessary drug for the condition or the chief complaint. In 2010, 1/3 of all active duty military members were prescribed an opiate at some point within that year. Again, a very alarming number. More in the military, there's 5 levels of care, 1 through 5. 1 is a combat medic, so there's going to be your kind of first responder, the first line of defense as far as medicine. 2 is your battlefield facility. 3 is your off-battlefield facility. 4 is your outside the United States facilities, and 5 is in the United States facilities, such as a hospital. Within the military, for pain that is low, the primary medication that's given will be some sort of NSAID. For any pain that is a high level of pain that can also be debilitating, the primary medication that's going to be used will be an opioid. And you see I've got morphine and the fentanyl up there, which are both opiates, and those are very largely used medications within the military. There's also the standard that if opiates are the #1 recommended medication if the pain is debilitating or if NSAIDs don't work. So you might try an NSAID. If it doesn't work, they move up to an opioid. It's a very large gap. There should be something in between, or something to prevent it from ever needing to go to an opiate. So acupuncture within the military is fairly relatively new within the military as an alternative for pain management medication, because they don't want to put their active members onto medication that's going to put them on a no-flight or no-fight list, such as an opioid, due to the psychological as well as the physical effects that it has on the body. So in a study of 172 military members, they used a Measure Self-Medical Outcome Profile, MYMOP, objective scale. These 172 members went through a 1-year trial where they received 4 acupuncture treatments. 60 days prior to the first treatment, they measured the amount of medications they took, the prescriptions prescribed, as well as the pain scale. And then 1 year and 60 days after their first acupuncture treatment, they did a check-in and evaluated the same things. The study found that opioid usage decreased by 41%, muscle relaxants decreased by 34%, NSAIDs decreased by 42%, and benzodiazepines decreased by 14%. In another random control trial, they found 8 out of the 9 random control trials found oral acupuncture, that in the ear, to be effective in reducing pain. Now, oral acupuncture is interesting in that there's several points within the ear that relate to certain nerve pathways that are able to mitigate and manage the pain appropriately. So it might be a little bit more useful than the long dry needles that you may be doing, let's say in your back, that you get an acupuncture specialist. This sort of field medicine with the oral acupuncture may be a little bit more applicable in the military setting. Now, how does this relate to athletic training? Well, we've seen that there are positive results for pain management as far as in the military setting. Now, there's kind of a little problem as far as athletic trainers within Virginia. While the NATA says yes, we are allowed to do dry needling, it's up to the states to regulate it. So if we wanted to do it, Virginia Athletic Training Certified and Licensed are not able to do such under the current scope of practice. So one, we'd have to lobby to the necessary government entities to try to allow athletic trainers within Virginia to be allowed to do so. The other kind of path we could take is that we could, instead of lobbying, which we could do at the same time, we could also just refer our athletes or our patients to an acupuncture specialist. Now, the specialist will perform the acupuncture, and this should be done in conjunction with a rehabilitation plan. As we know, we have to manage the pain, but we also have to correct or fix the base root problem, which can be done through the rehabilitation plan, hopefully. This is primarily another tool within the toolbox kind of mentality. A good thing to refer back to is that placebo treatment. There's about 13 people that didn't feel the needle itself. So we need to remember this may work for some people, may not work for everybody. It's rather one of those things that if we've done medication or the patient doesn't want to be on medication, we can refer them to the acupuncture specialist to try something different. Hopefully this acupuncture helps with the condition. We can take them off medication, reduce the amount of medication, reduce to a lower intensity of medication, and then it might lead to a better patient outcome. Thank you. And here are my references.